An ailing patient expects a certain quality of treatment when seeking health care. No one wants to be injured by an incompetent medical provider. The amount of physical and mental damages are incalculable. The experience is usually more traumatic than the initial injury. These are true and disturbing medical mistakes. Stratton v. Swanlord was a landmark case in medical malpractice law. It's the earliest reported such case. A surgeon was tasked with repairing a woman's mangled hand. The procedure was not successful, despite the woman's claims that the surgeon said he could cure her. She and her husband sued the surgeon for breach of contract. The case was dismissed due to technical errors, but the judge, Chief Justice John Cavendish, ruled that physicians could only be held liable when they are negligent in their duties. If the physician performs to the best of his ability and the outcome is less than desired, then they would not be held liable. The first documented case of medical malpractice in the United States happened in 1794. A husband sued a doctor after his wife died from an operation the doctor performed. Before the surgery, the doctor promised to operate to the best of his ability. The husband argued that the doctor operated on his wife in an aggressive and cruel manner, leading to the woman's death. The husband was awarded 40 English pounds. Shortly after, medical malpractice claims began to appear more and more in the 1800s. The 1960s saw a boom of them as complex treatments with higher risks of harm emerged. A jury in Wisconsin found that a hospital was 80% responsible for permanent nerve damage suffered by the plaintiff during hip surgery because it did not verify credentialing information provided by the surgeon. Information that was false. The surgeon falsely claimed on his application that he had privileges at other hospitals. This ruling that hospitals can be held liable even when a physician lies to them about their credentials proves the importance of proper verification procedures. The plaintiff in this case was awarded over $400,000 in damages. In Oklahoma in 1981, a man was brought to the St. Francis Hospital emergency room because he complained of pain over his breastbone that radiated to both sides of his chest. He was diagnosed as having gastritis and was released. A few hours later, the man suffered cardiac arrest and was returned to the hospital by helicopter where he was pronounced dead. The man's widow claimed the hospital was negligent in falsely diagnosing her husband and in releasing him rather than keeping him under observation. The man's wife received $75,000 in damages. In April 2003, a 42-year-old child care worker went to Jacobi Medical Center in Bronx, New York. She experienced pain in her left breast that radiated down her left arm. 2 biopsies revealed 2 masses. The surgeon advised the woman that the biopsy showed benign tissue that was read as negative. The woman continued to experience pain after her biopsy. After feeling the mass in her left breast grow, she returned to Jacobi Medical Center. Once there, she was told she just needed to allow the mass to heal on its own. In November 2003, the woman began suffering sharp, burning pain in her breast. In January 2004, she had another biopsy performed at a different hospital, Bronx Lebanon Hospital. The results were inconclusive. One more biopsy the following month finally revealed that the woman had stage 3A breast cancer. The woman claimed that the surgeon who performed her initial biopsy was negligent in failing to promptly diagnose her breast cancer, which lowered her chance for survival. The woman received a $1.25 million settlement. In 2007, an Illinois jury awarded an injured plaintiff almost $8 million. A podiatrist operated on the plaintiff's foot, even though her foot was not infected. This caused damage that eventually required amputation. The injured plaintiff claimed that the podiatrist should not have had surgical privileges because he failed to meet the hospital's credentialing criteria. California is the state with the most medical malpractice lawsuits over the past 30 years. The next 3 cases are some of the most true and disturbing medical mistakes any doctor could make. In April 2012, a 70-year-old man went into surgery to have his aortic heart valve replaced and an aneurysm repaired. The surgeon left the operating room while the patient's chest was still open. Allegedly, the surgeon went to a luncheon. He left his assistant to care for the patient. The patient lost so much blood that he slipped into a coma that he never came out of. The surgeon left the hospital to attend a luncheon. Hospital staff tried to contact the surgeon, but to no avail. When the case went to trial, the jury awarded the patient a total of $68 million, including damages for pain and suffering. A San Diego mother gave birth to a baby girl, Sophia, 5 weeks prematurely. 4 days later, the mother went to the newborn ICU to see her daughter. Once there, she found a terrifying scene. Sophia was pale and lifeless. Her feeding bag had leaked. Upon further investigation, nursing errors led to Sophia getting cerebral palsy. She will require medical care for life. The case was settled for $20 million. Dr. Kevin Searcy, a cosmetic surgeon in Fresno, California, was sued by several of his patients for allegedly botching their surgeries. Instead of continuing his probation, the surgeon surrendered his medical license in June 2022. Searcy has been named in at least 9 lawsuits from former patients. One lawsuit claimed negligence when the patient stopped breathing during a face and neck lift. Her heart stopped. Searcy tried to revive her, but after 7 minutes called the paramedics. The patient suffered a debilitating brain injury. The case was settled with the woman receiving $3.9 million in damages.